We're also, of course, dealing with the issue of the better the interventions are, the longer people live. And, of course, the economics of that is that we now have a much more elderly population who are dependent on the rest of the population in terms of income. You've got a much higher proportion of people that are outside of the national insurance windows. You've got a much larger population who are drawing state pensions. You've got a much larger population that are out with paying for things like prescription charges, etc., etc. So the demand and the burden is much greater on the state. And so, of course, what the state has got to do is make decisions, about politically and strategically what it wants to do, but secondly, about the process. And again, we're back to this issue about metrics. What information are we going to use to make us decide or help us decide which intervention we're going to deliver? You've got £1 million, you can spend it once. What we need to make sure is that we've got a good process that says that we spend that £1 million in the right way. If you're starting any new service, any new organisation, you've got to start with, okay, what are our principles about what it is that we're going to deliver? Are we going to deliver reactive healthcare? In other words, are we going to treat people only when they're sick? Are we going to deliver health promotion? In other words, we're going to actually promote healthy living so that people don't get sick in the first place. What we have to do is understand what our baseline is. What actually are we going to do? And to do that, you've got to consult with the people who pay the taxes and actually resource whatever it is that you're delivering. So once we decided what it is that we're going to do, we then need to lay down some sort of foundations about, well, okay, what's our minimum starting point here? You know, is there a point at which people will access healthcare? Is there a point at which we will start giving out health promotion information? Is there a point at which we're going to say, right, we're going to start giving free school meals to children? Is there a point at which we're going to say we're going to start giving out free fruit to people? Is there a point at which we're going to start to actually say our principles here are, and we are going to encourage people through the incentive of healthy food, low cost, high quality food to become healthy, to lead healthy lifestyles, free gym membership, that sort of thing, lead healthy lifestyles. We then need to set ourselves up in terms of, okay, what's the measurement that's going to actually show us where we are now? Because in a period of time, a year, months, we've got to measure our progress. We've actually got to measure whether or not what we've done has worked. And if you bring that forward to where we are with the NHS now, some 60 plus years since it was formed, we're at a point here where I think we talk about metrics. We need to understand both where we are now and where we want to be. We've started doing that in many ways, you know, with the central targets that we had and we've still got. We've got some sort of baseline figures. We know through our consultations with the local population, we know roughly what it is that service users want in terms of their principles. They're normally about access, about timeliness of service, about the quality of care, the customer care stuff that we've spoken about. But we then need to set down, okay, what are we going to aspire to? And how are we going to use that information that we've got to move us from point A to point B? Internally, though, what I need to do as an operational manager is I need to make sure that the staff that are delivering services get information which helps them to improve their services and improve the outcomes of the people that receive their intervention. So, for example, if I was to go onto a ward, a hospital ward, I need to say to the ward manager, the principles of your service delivery are about high quality customer care, speedy access, comfortable surroundings, clean surroundings, all the stuff that I think we know about. I need to say to that ward manager, what information, what measurements do you want at your level to enable you to make sure that you deliver all those things? Now, corporately, that ward will be part of a much bigger organisation. And the information that that ward manager needs and wants must feed into the corporate objectives. So the organisation will have objectives around access, quality, the environment, its key strategic intents. Now, what I want from that ward manager is for him to tell me, right, well, actually, if I get some good information about how long people are staying in my ward, that will be really useful for me, because I know how long they should be here. If you're telling me that they're here actually longer than that, I can deal with that. The outcome will be people will stay here shorter, which will mean that they're going home to their families and their communities much, much quicker. If they say to me, well, actually, I'd like some information about how many shifts of nursing time I'm using, and I know what my budget is, I know how much resource I've got to use, I can then make sure that they're used in the best possible way that makes them efficient. Now, if you take that from the corporate view, if all my wards are doing that, and all my units are doing that, and all my health teams are doing that, corporately we become a much more efficient organisation. But I think historically what the NHS has done, and I guess most public services have done this, we do our corporate level objectives and we measure them, but what we don't do is talk to the ward manager, the nurse, the doctor, the therapist, and say, what will help you, what measurements will help you to deliver a good service. If you take that level and then you talk to the user and you measure their experience, you're then able to actually change the way that you deliver your service at the right level. It becomes a much more bottom-up approach to how we deliver care. And it's a much quicker and a much more responsive way of delivering services, because if the ward manager knows that the patients are not very impressed with your service, if the ward manager knows that people are spending twice as long in the ward than they should do, he or she can do something about it, rather than the trust board, the chief executive, me, going down to the ward manager and saying, come on, this needs improvement.